I think I'd first say I'm a daughter, a sister, a dog owner, a loving partner, currently a consultant, and someone who's very, very passionate about health and health outcomes and health equity in the work that I do. I'm from Chicago originally, and actually my father immigrated to the US from China, and my mother is of European background, so grew up in a mixed diversity, mixed cultural environment, which certainly has an impact in my desire to travel and work abroad and engage in lots of diverse groups and people coming together. So I moved to Switzerland 6 years ago and have been living here since. So I think I chose to get into health at a very young age. So I was interested in high school and decided, I was really turned on by the science and by biology, and decided that I wanted to get into the health industry, and started with as a candy striper actually at my local hospital, which is sort of a student intern that was working administrative, doing some patient care, reading books, taking patients from room to room. So really since then have kind of been in love with the idea of helping people and caring about and the outcomes of people's wellness overall. So I knew as I said, I really enjoyed the science. I knew I wanted to work in healthcare, and I didn't know in what aspect though. So I went to university and I studied pre-med. I also studied business and finance. And that ended up taking me to Wall Street as a first step in that career, which sounds a little bit off the path from health, but what I was doing there was fundraising for biotechnology companies, doing investor relations to help bring really new innovations, new therapeutics, new devices to market. Hobbies, yes, absolutely. I love the outdoors, which is part of the reason why Switzerland to me was the ideal location, having a background in healthcare and then also being an outdoors person. So I ski, I hike, I climb, spend as much time outside when I'm not sitting behind a computer or behind a phone or behind a desk. So at Deloitte, I'm responsible for managing lots of teams, and what those teams are really out there doing is, again, I work in life sciences and healthcare. So we work with organizations, both public and private, to help improve access to health, to help speed up and adopt new innovations that are coming to market, and ultimately deliver that with more efficiency, reduce cost and waste in the system, and be able to create more productive people through the help of technology and digital enablement. So we do a lot of, for life sciences as an example, we do a lot of projects where we look at their new products coming to market and think about who are the customers that are going to benefit from these products the most? What is the unmet need that it's really serving? How do you think about the dynamics and the very challenging dynamics of pricing those products and what the value that brings to the actual health systems, whether it's savings in the cost of otherwise used healthcare, whether it's better outcomes for the patients, better wellness and lifestyle for the patients. So we help companies in terms of both deciding where it is that product may be best positioned to serve for the welfare, and also be able to produce growth for the organization that developed the product. My job in the future, given that as consultants we very much act as advisors, I think there will definitely be a continued role and a continued job in terms of advisors. But I think the topics in which we're advising on and helping companies to achieve may look very different. And I think there are a few trends that really drive that. We're seeing a really huge rise in the increase of consumerism of health, so people wanting to have their own say in wellness, using their own devices, using their own genetics to find out what's the best vitamins for them, what's the best diet that they want to choose. And so we're seeing that drive in consumerism really change the way that, let's say, patient engagement is happening. They're coming with ideas, not necessarily just taking the advice of the doctors in a very traditional model. I think we're also seeing a huge exponential increase in the innovation that's coming along. 20 years ago, we just decoded the genome, and the amount of science and technology that has been based off of that has been incredible, and we're now seeing curative treatments potentially come to market where it's no longer about treating but really curing a disease. Also seeing huge investments and huge efforts going behind diagnosis. We have so many treatments now available to us. It's so much more important that we're diagnosing people earlier into the right treatment. Those components of the scientific innovation will play an incredibly important role in terms of how we support our clients in bringing those. I think one of the major points that we talk about is data and the interoperability of data and how much data can then be more predictive in preventing disease or in allowing you to manage your own wellness. I think obviously data is a double-edged sword, and we have to be very concerned with privacy and the protection of individual interests. But imagine waking up in the morning and going to your mirror and you're telling you you're low on vitamin A and therefore you should eat this today. Or they've noticed a change in your heart rate over the last few days and maybe you should reach out to your virtual doctor. So I think there is a lot of change that we're seeing, and data is a fundamental enabler of that.